an easy subject to cover in 10 minutes, okay? Innovative solutions for rare eye diseases. So what I've decided to do, if this will go forward, let's have a look. Guys, it's not, okay, good. These are my financial disclosures. None of them are really relevant to the talk. So the first thing I would ask you is, be curious, not judgmental. If you see a child or a family with different things that you've never seen before, don't say, oh, it's too difficult, or I'm not sure what's going on. Be curious as to why you are seeing what you're seeing if you want to try and make the diagnosis or understand a rare disease. Innovation at its core involves challenging the status quo, thinking outside the box, and taking calculated risks to drive progress and achieve breakthrough outcomes. So I want to show you some examples of how I've been lucky enough to be involved with some of those things. I'm going to mention very briefly that Hannah Skanger, who is my genetic counselor, and I, together with several other people, did a genetic educator training course. We trained all these centers, their optometrists or technicians, to take a 3-generation pedigree, and we did that in 2014. 11 years ago, we introduced the ability to take pedigrees when it was not being done in any of these centers. And I know for a fact that part of why RIA, yes?
Just make more comments. And this impact of that training, Ken, you are seeing now. You are seeing cell jars. You are seeing GORA and LVP.
And we're seeing RIA.
RIA and yes. So you're seeing that impact coming and changing the patient care.
Thank you. That means a lot. Thank you. Thank you very much. But so I'm not going to talk a lot about that. It was a very detailed. We have, if you are interested in your area to do something similar, if you go to the WSPOS website, we have that ability to repeat that, perhaps a little bit better than we did it the first time. But thank you so much for that comment. Okay, here are the examples. Try and, if you want to look at rare diseases, look at a rare disease and then see if there's a generalizable application. Let me give you an example. This is a paper we wrote when we were looking at children with certain mitochondrial diseases. We noticed, and again, this is being curious, that when you looked at the cornea, something was not right. They had changes on the cornea that we were used to seeing in Fuchs endothelial dystrophy. See that on the OCT? And the question was, why is this happening? And this is a specular microscopy. This child is only 9 years old, and look at the cell count, look at the changes that you see, that you would see in Fuchs. Well, it turns out that if you look in the literature, there is reports of mutagenesis of mitochondrial DNA in Fuchs endothelial corneal dystrophy. And when you look at that DNA change, it's the DNA change that occurs most commonly when you see Kern-Serre syndrome or Pearson syndrome. So in the cells of the cornea, in adults with Fuchs, they have the changes that we saw in children with Kern-Serre syndrome. And here's another one which shows that there are degenerated mitochondria even when you have Fuchs in a COL8A2 mutation families. So based on that, and based on the work that we did, there are several studies going on now to see if you can rescue adult Fuchs with either coenzyme Q or preparations that are topical but are like coenzyme Q. So again, look at a rare disease that you can apply generally and you'll get more funding. What about large networks? Again, I am privileged to have been part of developing the Bodia Eye Consortium. Now, the Bodia Eye Consortium is a consortium of eye hospitals. They're all listed there, and you can see where they are up on that map. What is interesting is this. By having similar proformas that you fill in when the patients come in, you can then publish a study where the dropout rate, even though it's retrospective, is very low because everybody's filling the same proformas. But let me explain one other thing that's really important. We published this paper, and there was a very important point. It turns out that there is a difference genetically and anthropologically between ancestral North Indians and ancestral South Indians. Ancestral North Indians, genetically and anthropologically, come from 4 regions of the world. the Caucasus, i.e. Eastern Europe, the Mediterranean, North Africa, and the Middle East. So that means that when you do a study in North India, the genetic makeup is generalizable to the whole world except for sub-Saharan Africa. So if you are going to do studies, it is the only region in the world where that is applicable. So now, if you want to do a rare disease study, you do it in North India, you do it with a consortium, and this is the first paper we published. Shelja is in the audience, Suma Ganesh is in the audience, and this was clinical spectrum of non-syndromic microphthalmos, anophthalmos, and coloboma in pediatric population. We got 532 cases in just 12 months. The only other study to have numbers close to that, 312, took 16 years from North America. So think about the power that you have by forming a consortium of eye hospitals that work together. And Umang Mathur is really, he made sure it happened, but we had lots of morning meetings, if everybody remembers, 6 o'clock in the morning for me, a little bit later for you guys, where we started the Bodhia Eye Consortium. So think about large networks, because you get large networks, and as Shelja has proven, you can get funding that is internationally recognized. What about developing large disease-focused studies? This is harder, but again, I want to show you this. LCHAD is a very rare long-chain fatty acid disorder, and they get changes in their eyes. So a whole group of us right across America and in fact Europe got together and we collected all our cases. And what we showed for the first time was we showed firstly the natural history. If you look at A, this is how the patient presented in the teens, and by the time they're 30, look at the atrophy that they get of the retina. And you can see in cross-section, you can do OCA, you can do photoreceptor en face. You don't need to do that. The images show very clearly that there's a change. But this is the power of a natural history study. When we looked at the number of children who got, or the number of patients who got that horrible atrophy and lost vision, if there was early diagnosis, you could prevent it. And because of this paper, they started newborn screening in Europe for this condition, which never existed before. Okay? So again, large disease-focused studies. Collaborate with non-ophthalmologists. This is the most powerful thing that I have done ever. The more I work with non-ophthalmologists, the more I understand eye diseases. So, this is the first paper I published with Nathan Clark. Subterranean mammals show convergent regression in ocular genes and enhancers along with adaptation to tunneling. Let me explain what that means. All of these animals, over the last several thousand years, have lived underground. If you live underground, which organ do you not need? Your eyes. So what we looked at, and this was Nathan, and I met Nathan in a coffee shop, right? I met him in a coffee shop. He works at the university, and we started talking. So if you look at, let me show you a little bit better here. If you look, ROM1 is GNAD1 is a retina-specific gene. And when you look at it, everything in red means that there's a much higher rate of mutation. So even evolutionary biologists believe that if you don't need an organ, the mutation rate, the daily mutation rate goes sky high because the body's trying to get rid of that organ. And through a series of experiments, we showed that in subterranean animals, the visual perception genes are at a much higher rate of mutation. Why is that important? Well, it becomes important because we now have identified a whole bunch of genes that some of which we know are to do with the eye, and some we don't know have anything to do with the eye. But we know they're mutated at a very high rate. So when we see a rare disease and we don't have a reason genetically, we start to look at the genes that are being mutated at a high rate in the subterranean mammals that might be also present in the patients that we're seeing with no diagnosis. In this way, we are then able, through convergence and looking at enhancers, identify genes that become putative genes for eye conditions. And in fact, we just published our first paper where we found a gene for congenital aphakia that was not due to FOXE3. So it's really important that you think about working with other people other than ophthalmologists, because that way we can actually make great progress. And on that note, please join the International Congenital Corneopathy Network, and there'll be a virtual meeting soon. That's the QR code. Register, and let's see if we can try and cure some more rare diseases. Thank you.
Thank you very much, Ken, for a very fascinating talk. Thank you very much.